greatest wealth is health. These words of Ralph Waldo Emerson, an American philosopher, captures the universal importance attached to a healthy mind in a healthy body. The need for a functional health sector in any society cannot be overemphasized, as it plays a very crucial role in the growth and development of the economy of such society. It is no longer news that humanity over the past few months is endangered with the outbreak of coronavirus, also known as COVID-19. This pandemic is the greatest challenge the world has ever faced since the World War II.
The exploits recorded in the health sector in Delta State, South Nigeria, under Senator Dr. Arthur Ifeanyi, which has helped the state to contain the spread of previous infectious diseases such as Lassa fever, chickenpox, monkeypox, and many others in the past, has continued to help strengthen the state's preparedness in the face of this uncertain time. Come with us as we take you through some of these immense contributions of the Okowa-led government in building an enviable health sector in the state. The Delta State health sector, under the watch of Governor Ifeanyi, has over the past 4 years continued to receive priority attention despite the challenges of funding multiple government programs. With many years of experience tucked under his belt as a medical doctor, Senator Dr. Ifeanyi has continued to uphold the mandates of SDG Goal 3, which borders on health care for all, to achieve universal health coverage. His administration has strengthened primary health care delivery to ensure that every Deltan enjoys accessible, quality, and affordable health care delivery.
He has achieved everything. I call Governor Okowa'S the God-sent health of Delta. He's touched virtually every facet of the health sector. There's no area in the health sector, as far as I know, that Governor Okowa'S has not touched.
Delta State, we are doing our best because we have somebody who is a medical doctor, who is the governor of this state. He has so much passion because that is his profession, and he's doing a lot. That's why you see that a lot of improvement on the health sector in Delta State, and we are very happy with that.
Committed to investing in health rather than budgeting for impending disease, the Delta State's Primary Healthcare Development Agency, a parastatal of the Ministry of Health, is delivering on its mandate through the provision of the necessary primary healthcare services to the communities through its 440 primary healthcare facilities in the 25 local government areas of the state. The government, while citing these facilities, has ensured that at least one is located in each political ward of the state, thereby taking healthcare services to those at the grassroots.
The viral primary care system is what you actually need to ensure SDG 3 is achieved. His Excellency is a PAC man. He has always supported primary health care, and we want the health to be approached through primary care that is very accessible. Centers are in every community and the services are there.
With primary health care, you can get to the grassroots, and because of these free drugs that he brought for us, we always appreciate him because we meet the women in the grassroots and the children. The primary health care does a lot. It started with health education. You have to educate the people to know about what we are selling and the importance of the facilities.
The commitment of the governor to foster wider health coverage without digging too deep into the finances of the masses propelled the establishment of the Contributory Health Commission, which up till date has been able to provide prepaid health services to over 700,000 registered enrollees.
The scheme is for all residents of Delta State. So what we basically did was compartmentalize the state residents into two groups, the rural communities and the urban communities. We have approximately 700,000 enrollees in our health insurance enrollment database, and the number changes all the time because we have multiple agents. So whenever we give numbers, we're not usually very specific because whatever number we give automatically changes.
This policy over time is gradually tackling the rise in the cost of healthcare services, even as the Commission has continued to ensure equitable distribution of healthcare costs among different income groups. Smart Delta Media team had a chat with the chairman of the Delta State chapter of the Nigeria Labour Congress, NLC, Comrade Goodluck of Obruku. The Labour leader, while applauding the efforts of the government, said the mandatory health coverage for civil servants in the state is helping to build healthier workforce for Delta State.
Since the scheme started in the state, we have been getting reports from our members that whenever they are healed and they go to hospital without money, they have been attended to and all the necessary drugs have been given to them. So we are impressed with what is happening with the scheme. So we thank the governor for the foresight.
I will give a kudos to the governor for ever thinking of this, because like the other time my colleague's son was admitted, if it were to be before, I know how much she would pay, but she didn't pay any money.
I don't have any money with me now, but because of this Delta Health Insurance, I can come here, they will treat my children, they will attend to me, then I will go home. I'm very, very happy for this thing that they are doing.
The successful implementation of the maternal and child health component of the health insurance scheme had continued to attract accolade to the Okowa-led administration. In a bid to reduce infant and maternal mortality, expectant women are catered for from antenatal to post-delivery. As such, both pregnant and new mothers have expressed gratitude to the state government lifting financial burden off them and also providing quality and tangible services in the various centers. Hear them.
At a point when I realized that my baby was in the breech presentation, knowing fully well that I was going to end in CS. And when I made inquiries, and I was very surprised when my matron told me that it's free. As you can see, even to blood transfusion, everything is free. I say a very big thank you to Dr. Ifeanyi Okowa.
I want to thank the state government for what they did by providing free maternal and child health, for free theater, everything my brother's wife did. All the money has been paid by the state governor.
They are trying for us right from when the baby was in my womb. I registered here with them. They are really good. Even the nurses, the doctors, they tried for us. Everything here they give to us is free.
The contributing health scheme is really helping the community members in the sense that those pregnant women, they don't register in health facility before because of what? Finance. But now it's free. More grace to his able, Dr. Okowa.
The number of children under 5, pregnant women, physically challenged, the vulnerable including the elder, 65 years and above, and the widows who are catered for under the equity group keeps surging up daily.
They take care of us health-wise. It has helped me in so many angles. I want to say very big thank you on behalf of the widows, because I have not seen such. Since he decided to take care of widows, God will take care of him and his family in the name of Jesus.
The governor has been helpful to us, myself, since he entered into office. I've been a beneficiary for free medical treatment and they be attended to us. I plead that he shouldn't stop.
The various commitments of His Excellency towards firming up the sector through the upgrade of the primary healthcare services and the contributory health scheme with the training of doctors and creation of properly equipped health facilities across the state has contributed greatly to the state's preparedness in the fight against the COVID-19 pandemic.
I see our governor as somebody who is proactive. Even before we had our first positive patient, we were already on the ground. We had people trained, we had health workers trained, this place is built by the state government and is fully equipped. And all of this he did because he wants to prepare us to deal with this emergency.
I'm so glad that we have him as our governor because he has been proactive in the steps that he has been taking and we are following that lead. It is why, for instance, we already have an accommodation for doctors and nurses who will be looking after the patients. We also have holding facilities for doctors who may be inadvertently exposed to this condition.
The governor, upon the confirmation of the first COVID-19 case in Nigeria, swung into action immediately by taking far-reaching proactive steps. One of such was the establishment of 4 isolation centers at existing hospitals and equipping them with needed equipment and other medicaments prepared for anything COVID-19 might throw at the state.
The rooms installed with ventilators and every other facility. And very importantly, there is a side room in which the nurses are able to completely monitor every activity going on in every room, which is really, really very good. They are fully ready, and the trained staff are fully ready, and I can truly say that this center is ready to receive any case.
We have treatment and isolation centers fully completed and equipped. 4 of them, one at the Federal Medical Center Asaba, one at the Asaba Specialist Hospital, one at the Okowa'S Teaching Hospital, and of course, one at the Central Hospital in Warri. This is a strong indication that Delta State is combat ready to be able to deal with COVID-19 cases.
We've been really impressed by the efforts of the governor, the level of preparedness, both in terms of how you've handled the few cases you've had, but in your preparedness for cases to increase. So Delta is prepared.
We are encouraged by what we have seen. And we really want to appeal to the people of Delta. The risks are still very high, so we really would like everybody to remain vigilant.
Smart Delta Media Team, in a bid to find out more facts about the several smart initiatives of Governor Ifeanyi Okowa to combat COVID-19, made follow-up visits to some of the isolation centers in Asaba, Warri and Ogara.
The state government was being proactive when we brought up the idea that we could do something where special patients are treated. And the governor said, fine. You remember His Excellency is a doctor. And so he understood and said, fine, let's get an isolation center ready. So our patients who have any of them, monkeypox, Lassa fever, whatever it is, not even COVID then, could be managed here. So this was completed about 7 months ago, way ahead of COVID.
In terms of performance with respect to COVID-19 prevention in Delta State, His Excellency, the Governor of the state, has done excellently well. And you can see it with the number of treatment centers that we have in Delta State. You don't have that number in any other state. Trainings have been going on even before now with respect to management of patients who end up with COVID-19.
Actually appreciate His Excellency for the work he has done to ensure that we have the things to work with, because that is the number one thing, our PPEs.
Some of these isolation centers are currently managing the few confirmed cases in the state. The medical practitioners and healthcare service providers who are in the front line in fighting this deadly virus at these facilities narrate their experiences while appreciating the government for providing the needed equipment and facilities in the management of this infection.
The government, they've done so well because we've really not had a situation where we lacked the PPEs. and the N95. Prior to this time, they invited our staffs for training severally. They didn't even do the training for only those that are here. They did it to the entire hospital. It's been wonderful.
Delta State government, they are really doing well. I really was not expecting such a thing like the PPEs to be this available in Delta State. As we are training, they do not see it as an issue to release those PPEs to us. They do give us freely with maximum cooperation. The little patient that we have now, they don't see it as an issue to release those PPEs to us. We use them to the core when it is necessary.
Aside making available this equipment, the state governor has ensured the health authorities in the state organize and train medical personnel and other first responders. Some of these trained health officers speak with Smart Delta.
Delta State government have been so wonderful. They have provided us with all the necessary material we needed for the IPC. We were trained on infection prevention and control, on COVID-19 and other public health infectious diseases. The training was wonderful because before now there are some information we lack, but with the help of the training we were well equipped to handle any infectious cases.
It has been fun. At the same time, it has left us with some degree of panic and scare, but because of the training we had, knowledge is power. We were equipped adequately to face it. But I must tell you that we are in war, but we are prepared.
As part of further measures rolled out to contain the spread of this deadly virus in the state, the government has embarked on various sensitization campaigns across the state to further enlighten the people on the need to avoid the spread of the virus. This is predicated on the fact that it is easier to prevent than to cure. With the continuous increase in the number of confirmed cases nationally and globally, the state government makes adjustments accordingly. With the coronavirus infestation in Nigeria rising from single to triple digits, Governor Okowa'S had to extend the total lockdown in the state for another 14 days.
For all those who have obeyed a stay-at-home order, we want to thank you. I want to let you know that it's for the interest of the general good of all Deltans and Nigerians as a whole. By the powers vested on me in line with the Quarantine Act and the subsequent Infectious Disease Regulation 2020, I hereby extend the stay-at-home order for another period of 2 weeks. We do know that this will cause some pain to our people, but it is for public good and for the interest of our health. And I want to urge all Deltans to please observe the stay-at-home order.
Delta State government takes the issue of compliance very seriously. For instance, this is the border post between Delta and Edo states, Saturday, 4th of April 2020. Drivers of this long queue of fuel tankers on essential duties were screened before allowed into Delta State. Pedestrians were also screened, and those without cogent reasons were denied entry. There are no sacred cows, so Smart Delta Media team members were not spared as we submitted ourselves to the protocols before entry.
Turn and go back. Turn and go back. Don't do your test and go back to where you're coming from. Since you cannot obey the rules.
The governor has assured that all the medical personnel in the front line of the fight against this pandemic are duly compensated.
I want to reassure both our health staff and the auxiliary staff that they will be adequately remunerated in the course of their duty. We are working out the amounts of money that they'll be paid on a daily basis for the work that they do. We must appreciate them for the great work, the great commitment, because they are in the line of duty to help each and every one of us and for the good of each and every one of us.
To further underscore the Okowa-led administration's determination to combat COVID-19 to a standstill, the governor has directed the production of face masks locally. This important and scarce piece of PPE, crucial to stem the virus's spread, has become an important part of fashion sense globally. The directive for the production came via one of the governor's several broadcasts to Deltans.
The Delta State government has gone ahead to start the production of face masks, but this time the one made with a cloth. And this face mask will be distributed free of charge to all Deltans.
We are concerned about majorly the life of our people here, and so we need to take decisions that will indeed protect them. So as a government, we will commence the distribution of free face masks, the cloth face masks being produced by the state government. Our target is to produce 1 million of the face masks. And once that is out, we'll begin to enforce the compulsory wearing of face masks once you are to appear in any public gathering. Otherwise, the law will take its course.
The directive for their local productions by government's trained fashion designers who are now fully established on their own have been applauded. It is another way of wealth creation for Deltans at a time when many Deltans and indeed millions globally are filing for unemployment and bankruptcy. Smart Delta Media went round visiting some of the designers and producers of these face masks as they share their experiences and testimonies.
To me, I didn't even believe that the governor would say, okay, let's produce the masks in our own state. It's a very good thing he has done, and I praise him for that.
Apart from the money, at least the government is seeing something useful from we that are the citizens to do this stuff now. I feel very happy for taking part in this life-saving exercise.
Executive Governor of Delta State, he trained the youth area of skill acquisition, and now the need of face masks have arisen. And he didn't say, okay, let's take it to Lagos, let's take it to Abuja, let's take it to Aba, where there are other well-known tellers. No, he gave it to the people he trained because he knew that he gave them the very best. And as you can see, they are meeting up, they are supplying the face masks as he asked.
With all these measures in place to fight the virus, Smart Delta Media has been flying over some Delta's major cities to see bird's eye view of citizens' compliance to the lockdown directives. With Governor Okowa'S commitment and determination to protect the health of all Deltans as the lockdown, social distancing and other government protocols to fight COVID-19 continues, the government and good people of Delta State pray and hope all remain safe and come out of this pandemic unscathed and stronger.
Delta State government is committed to building a stronger Delta. Whatever agitates your mind, ask it, and we will get you answers.
Now we would actually urge all Deltans and non-Deltans to continue to be in tune with the Smart Delta team because they're everywhere. It's important to get informed about what is going on in this state. If you're going to pass suggestions to us as government, your suggestions will be welcome. To know more about them, follow Smart Delta on their various links.
Send your questions to all our social media platforms with the hashtag #AskIt on Facebook, Instagram, and Twitter, or text 0901-665-2274, airing on AIT, Channels TV, Silverbird, NTA Asaba, DBS, and DRTV.
You better run, come to Delta State. Come and see the good things where Okowa'S they do. You better run, come to Delta State. Come and see the good things where Okowa'S they do. I see a job and work creation in Delta, make the youth say them highlight. Okowa'S. I see good roads everywhere in Delta, make the people say them cola. Come live in Delta. Say me